Robotic surgery is no longer just a high-end concept limited to big hospitals in metro cities. It's quietly becoming one of the most important shifts in India healthcare system. For years, advanced procedures using robotic systems were available only in places like Delhi, Mumbai, or Bangalore. But now the story is changing and fast. Experts believe robotic surgery is about to transform healthcare access far beyond India's metros, reaching Tier 2 and Tier 3 cities where quality medical care has traditionally lagged behind. So, what exactly is robotic surgery? Contrary to what many people think, robots are not operating independently. These systems are controlled entirely by highly trained surgeons. The technology enhances precision, stability, and control, allowing doctors to perform complex procedures with smaller incisions, less blood loss, and faster recovery times. In simple terms, it helps surgeons do their job better with more accuracy and fewer risks for patients. Now, here's where things get interesting. Until recently, the biggest barriers to robotic surgery were cost, infrastructure, and training. The machines are expensive, hospitals need specialized setups, and surgeons require advanced training. That's why only top tier hospitals in metro cities could afford to offer it. But over the last few years, several changes have started breaking these barriers. First, the cost factor is gradually coming down with more companies entering the space and technology becoming more accessible. Hospitals outside metro cities are beginning to invest in robotic systems. Government initiatives and private healthcare expansions are also playing a big role in pushing advanced medical infrastructure into smaller cities. This is a huge shift because it means patients no longer have to travel hundreds of kilometers just to get quality surgical care. Second, training and awareness are improving. More surgeons from non metro regions are getting trained in robotic assisted procedures. Medical institutions are focusing on upskilling doctors so they can adopt these advanced techniques. As the skill gap reduces, the availability of robotic surgery will naturally expand. Third, patient awareness is increasing. People are more informed today than ever before. With access to the internet and health information, patients are actively seeking better treatment options. They are willing to choose hospitals that offer advanced technology even in smaller cities. This demand is pushing hospitals to upgrade faster. Now, let's talk about why this matters so much. In many two-tier and three-tier cities, access to quality surgical care has always been a challenge. Patients often delay treatment or travel to metro cities, which adds financial and emotional stress. Robotic surgery can change that. It brings high quality care closer to home, shorter hospital stays, quick recovery, and reduced on complication mean patients can return to their normal life faster. However, let's keep it real. This transformation won't happen overnight. There are still challenges. The initial investment is high, and not every hospital can afford it immediately. Maintenance costs, training requirements, and ensuring consistent quality standards are all hurdles that need to be addressed. Also, affordably for patients is still a concern. Advanced procedures can be expensive, and insurance coverage needs to evolve to support wide adoption. But despite these challenges, the direction is clear. Healthcare India is moving towards decentralization. Advanced treatments are no longer going to be limited to big cities. The gap between metro and non metro healthcare is slowly shrinking, and robotic surgery is one of the key drivers of this change. Looking ahead, the future is promising. As technology continues to evolve, robotic systems will become more efficient and affordable. Competition among manufacturers will further reduce costs. Telemedicine and remote assisted surgeries could also become more common, allowing expert surgeons to guide procedures even from a distance. Imagine a skilled surgeon in a metro city assisting a complex surgery happening in a smaller town. That's not science fiction anymore. It's a real possibility. So, what does this mean for you? If you are a patient, it means better access to advanced healthcare without the need to travel far. If you're a healthcare professional, it means adapting to new technologies and continuously upgrading your skills. And if you are simply observing the healthcare landscape, it means witnessing one of the most important transformations in modern medicine. To sum it up, robotic surgery is not just about technology, it's about access, quality, and improving the quality of life for millions of people. As it expands beyond India's metro cities, it has the potential to redefine how healthcare is delivered across the country. The journey has just begun, but the impact could be massive. If you find this insightful, make sure to stay updated because healthcare is evolving rapidly. Understanding these changes can help you make better decisions in the future. Thank you.